When we think about, health and health promotion and disease prevention, that actually starts at the environmental level. That there's no point patching people up if we're contaminating them at the very source. And that this industry is really harmful to unborn babies, to our children, to the people who are unfortunate enough to be working in it. They're working with chemicals like benzene and toluene and those things that are landing in our water. We don't want to contaminate our beautiful water supply. We don't want to contaminate our soil. We want to have beautiful farmland to grow healthy food, to have healthy communities. So thank you for being here. So these are all the healthcare providers who would have been standing here on the front line if they weren't working. Information coming out of the states, places where they've been having this kind of unconventional gas mining for some time now, there's really very convincing evidence that their health effects are detrimental. And if we look individually at the chemicals, we already know their safety profile is bad. We know that they're carcinogens. We know that they're thyrotoxic. We know that they are endocrine modifying chemicals. We know these things already. They've been well studied. There's a myriad of different ways that we can end up exposed to these chemicals. So I would be very concerned if my family were working in this industry. I'm very, very concerned.
I'm a paramedic. We quite often respond to work sites like this. So obviously, quite selfishly, one of my concerns is responding to a place like this. If there's a problem, we're going to be exposed. When I go overseas on relief to disasters, the first thing you establish is clean water. We've got clean water. What are we doing to it?
And it does distress me that we are going to have generations of people being sick as a result of this short-term gain industry, and we're going to be affected for eons. Yeah. We're all here to look after each other. Our community, we're well known for it, the Northern Rivers. If they get through here, my God, I'll be very worried then, because we've such a stance here. Yeah.
So I'm Harry Freeman. I'm a local psychiatrist, a doctor. I've been up here for about 40 years. I think everybody knows what a good feeling it is to sit around a campfire and think that everybody's thinking the same thing. You come away from that just with your heart expanding and for your mind to encompass the whole picture with a bunch of people who are thinking the same stuff.
Hi, I'm Wendy. I also work at the small base as a midwife, but I'm a local born and bred. This is my backyard and I want to protect it. I was fortunate enough to grow up in the Lismore district, and I'd like to see my grandchildren have the privilege of growing up in a clean environment, and coal seam gas is not going to provide us with that.
My greatest fear is that the health repercussions will be something we will see into the future in our local hospitals. We're already struggling in our public health care system. How well can we accommodate for the future of small children?
Community and health, I mean, that's more important than money anyway. Community and health is what matters. That's, listen to our community. We don't want coal seam gas.